And with that, I'm going to introduce our speakers. We have Dr. Kara James. She is the Director for the CMS Office of Minority Health. My name is Monique LaRock. We also have Ashley Petticord Austin. She is a health insurance specialist at the CMS Office of Minority Health. We also have a few guest speakers from the field. Rebecca Bradley. She is the Program Manager for State Health Insurance Assistant Program, and she comes to us from Baltimore City Health Department. Thank you, Rebecca. Monica Gonzalez is the Project Director for the Epilepsy Foundation of Florida. And we have Monique Scott, Health Insurance Specialist from our CMS Regional Office 3. We have a very robust agenda for you today. We're going to do a brief overview of the office, talk about coverage to care, and share new resources that we have available, and then talk about how to get involved. We'll also have an interactive discussion and answer period. With that, I would like to turn it over to Dr. James.
Thank you, Monique, and good afternoon to all of you, and appreciate you joining us today as we're talking about From Coverage to Care. And I especially want to thank Rebecca, Monica, and Monique for joining us and sharing their stories with us. So the CMS Office of Minority Health is one where we work to ensure that the voices and the needs of the populations we represent are present as the agency is developing, implementing, and evaluating its programs and policies. And as you can see, our vision is towards working to make sure that all CMS beneficiaries have achieved their highest level of health and that disparities in health care quality and access have been eliminated. 4 years ago, we started From Coverage to Care as one of those efforts to help ensure that beneficiaries could achieve their highest level of health, thinking about individuals who are obtaining coverage, some for the first time, or some for the first time in a long time. And as we thought about who those individuals are, many of them low income, individuals who have limited English proficiency, individuals who may not have a usual source of care, we really thought it was important to figure out how do we help them to connect to the care that they need. And so we produced and developed From Coverage to Care, and it's an initiative that aims to really help individuals understand their coverage and connect to primary care and preventive services. Since launching the initiative, we've been working across partners who are embedded in these communities and really work with the stakeholders to understand and share the information with them. And we've continued to learn and build new resources that we're going to talk about today. So we're so excited that you are joining us and hope you will continue to partner with us to help individuals as they journey from coverage to care. And with that, I'm going to turn it over to Ashley.
Thanks, Kara. And so given what Kara gave us about the background, you might imagine that the goals of Coverage to Care are, of course, to focus on increasing the consumer's connection to care and eventually to better a person's health outcomes. So right now, with both the Medicare and the Marketplace open enrollment periods being over, we, like many of you, are turning to Coverage to Care and health literacy education with that goal of making the consumer connection. So the main points that we want to focus on currently are trying to find a provider, making an appointment, and using free preventative services. So let's hear some of our current resources that are available to help you do this. The most familiar one to many of us is the Roadmap to Better Care and a Healthier You. Also listed is 5 ways to make the most of your health coverage. We'll talk about each of these a little bit more, but they are available in 8 languages, and I'll list those now. English, Spanish, Arabic, Chinese, Haitian Creole, Korean, Russian, and Vietnamese. We have a number of other resources to assist, some video vignettes that are great for waiting rooms, health fairs, or other events. And we have some new animated videos to add to those that we'll talk about today and have a sneak preview of. And then there's our enrollment toolkit, which is particularly useful during open enrollment. And there's a suite of prevention materials, including flyers on free preventative services and some talking points on why prevention is important and why it's an important piece of healthcare. And then the last 2 resources on the slide we'll also go over today. And those were created to assist you, our partners. One being the Partners Toolkit, and the second, the Community Presentation, a set of prepared slides on the roadmap. So first, we do want to highlight our website, This is a screenshot of our current page. You can see it's hosted on our CMS OMH website. And along the top, it lists from coverage to care, and right under that banner, some quick links to drop below to resources for consumers and their families, or resources for our partners on the Get Involved section. Do keep an eye out. Our website is being updated actually today. So in the next week, you'll see an updated version that hopefully will be even more consumer friendly. We're trying each year to make it a little bit better. As a reminder, all C2C resources are available online on our site, or you can order many from the CMS product ordering warehouse, which will ship materials to your organization at no cost. So let's spend a minute on our signature piece, the roadmap to better care and a healthier you. It explains what health coverage is and how to use it to receive primary care and preventative services. So there's a roadmap poster, some consumer tools like the sample explanation of benefits, a sample insurance card, and a chart depicting primary care versus emergency care. As we said, the roadmap is available in 8 languages, but there is also a travel version specific to those populations and a customizable PDF. The PDF is a version that you can add your own contact information or other local resources. The pictured here is the actual roadmap. As you can see, the roadmap lays out a path for the consumer to connect to care, starting with step 1, put your health first. This is where we like to talk about prevention. Then we walk a person through understanding their health coverage and highlight key terms under step 2. Third, step 3, knowing where to go. This is where we address the emergency room and when to know when to use the emergency room and when to use primary care. Then to choosing a provider in step 4, making an appointment, being prepared for the visit, followed by step 7, one we often forget, where a person should actually decide if the provider was right for them and they felt comfortable. And then finally, we have step 8, next steps after the appointment. Each step can be its own lesson. The roadmap is structured so you can take it in pieces or as a whole. So you can walk through one step at a time or take the journey all at once. We heard from many of our partners that we needed something for consumers to quickly view and immediately know what they need to do to use their coverage. So we created the 5 ways to make the most of your health coverage. We don't want to confuse anyone. The roadmap and its 8 steps are the complete outline for connecting consumers with coverage to live a long and healthy life. But sometimes we need a quick view of what we need to do right away once we're enrolled. So we have the front-back resource of 5 ways to make the most of your health coverage. You might find this particularly useful if you only have just a minute with a consumer, such as at a health expo, another event, or after an enrollment appointment. This resource is to help consumers and community organizations focus on the most important and most immediate needs so people can actually use their coverage, or as we sometimes say, get what you pay for. So here on this slide, you'll see the 5 pieces that we wanted to highlight as those to focus on right away. And there is first, confirm your coverage. Often this is done simply by receiving an insurance card, but the other important piece is to pay that premium, especially that first premium. This way consumers can know that their coverage is there when they need it. Second is to know where to go for answers. If a consumer has questions about the details of their plan, like whether a service is covered or how much a copay might be, they need to know how to find the answers. Likewise, consumers should have an idea of what their actual cost would be, what their premium might be, their copay, or a deductible. So remember, the roadmap has a glossary with all these terms. 3, finding a provider who accepts the health coverage is an important step many of us neglect. Doing number 3 reminds us to search our plan directories and find an in-network provider. Hopefully if we do this ahead of time, then we have the provider when we need it. But that brings us to step 4, the important part of actually making an appointment. We need to set aside this time to ask questions and talk about preventative services with our provider. And finally, fill prescriptions. We often hear this is the largest need for many of our consumers. So it's important for a consumer to check if any prescriptions need to be refilled, and they know what pharmacy they can use, and about how much it will cost. There are, of course, differences in the premiums for generic and brand name drugs, so being able to find this information will help consumers understand and prepare. Like all our products, this is in the CMS product ordering warehouse and on our website as a PDF. and it is available in 8 languages. So those are some of our main resources that we use for health literacy and connecting consumers to care, but we do have a couple new ones that we want to highlight today. The first one is an animated video. We're really excited about this piece. It builds on the 5 ways that we just discussed, but it does it in a different way. It's a short and cute animation about how to use your coverage and connect to primary care, but it's a little bit different, and we're hoping to attract people's attention in a different way, maybe reach different consumers who maybe wouldn't have paid attention to a PDF or a resource at an event. So this video is 1 minute, but there are also shorter cut downs, and those are listed on your screen, and again are based off the 5 ways. All of these are available in English as well as Spanish. So we hope you'll be able to share the video on social media and with your consumers. So whether it's Facebook or Waiting Room or reposting our social media posts and graphics, you can help share it with your consumers. So now if you'll give us a minute, we're going to actually play the video. And the video is on YouTube, the CMS YouTube page.
While we're waiting, we do want to encourage you to ask us questions in the chat feature. Please feel free to send us any questions that you have, and we'll be monitoring it. In addition, I wanted to highlight the materials for this webinar. There is the C2C webinar presentation. It's on your right under the handout section. We also have some information about how to order materials. If you need things in your community, we are here to help you. You can download them, and you can also get free printed copies at no cost. I did want to share our website. We do have these materials available at go.cms.gov/C2C. We also want to stay connected with you, so if you have any feedback, we'd love to hear from you at coverage2care@cms.hhs.gov.
But never take it out of the box? Would you invest thousands of dollars in a car, but never drive it? Or even buy your dream home, but never actually live in it? Of course you wouldn't. So why should you get health coverage, but never put it to use? And Coverage to Care can show you how to maximize your health coverage. And you have coverage. Know where to go for answers, and contact your health plan if you have any questions. And for the most affordable healthcare options, find a provider who takes your coverage. Make an appointment. Don't wait until you're sick. It's finally time to fill any prescriptions you may need. Live a long and healthy life and make the most of your health coverage. For more information, visit go.cms.gov/C2C.
Okay, thank you for playing the video. So then that's one of our newest pieces. And again, it is on the CMS YouTube page, and you'll have links that you'll see on our website as well. And another brand new resource that we want to talk about today, also to be posted on our website, is the Manage Your Healthcare Costs. So many of our partners will receive questions from consumers about all aspects of health coverage. Whether you help them enroll or you help them find a provider, they'll come back to you and ask you questions about many other things. So many of you help people choose a plan or review deductibles, but you, like us, are not financial advisors. So we needed a few tools to help our consumers. Given that feedback, we developed Manage Your Healthcare Costs to meet this need. This resource walks through financial aspects of health coverage, offering definitions of what to consider, then provides tools that you can offer to a consumer that the consumer can then take and use to determine what they can afford and how they can afford to use their plan. This helps support our goal of actually using our coverage to receive care. I would note that this resource is based off of the Consumer and Financial Protection Bureau's My Money, My Goals. That is a much larger resource if you need further assistance for a consumer. So first, we offer definitions and explanations of what the costs are that are involved. Then we offer a person a place to list those for their individual plans, so it's easy for them to find. Next, we offer tools of what to track, what income is coming in, what costs are going out, and what that means in terms of their health coverage and what they can afford to pay for out-of-pocket costs like premiums, copays, and deductibles. And finally, we offer information on how to pay a premium. So our first section, we discuss what a consumer pays, spending limits, and the ways people can save. So listed here are some of the most important definitions to review with a consumer when it comes to financial aspects of health coverage. Make sure consumers know their premiums are paid monthly, regardless of whether they use coverage. Deductibles are an important term because they can be tricky to understand and they do vary from plan to plan. So be sure to offer a definition and clarify that some services, like preventive services, are covered even if the deductible has not been met. So give examples to help someone understand, like a flu shot or high blood pressure screening. That way a consumer can understand that it is affordable to receive a particular screening or vaccination. And then finally, copay or coinsurance. We find the best way to define these with a consumer is to offer an example. So on this slide, and in our Manage Your Healthcare Costs resource, we offer some examples. Next, we want to discuss spending limits. So review out-of-pocket and what that includes, and then talk about the limit. This graphic might actually help you to explain it to a consumer. The deductible and the coinsurance and copay all lead to the out-of-pocket limit. So finally, we discuss savings and how a person can save with health insurance. So many of you probably already know the different types of financial assistance. But in this discussion, let's also include information on the essential health benefits and preventative services, because these are some other ways a consumer can find value from their plan. So including information about the 10 essential health benefits, each of the marketplace plans has these, as do many others, but we need to allow a person to understand what they are actually getting for their plan, for their money. And then preventive services, of course, are available at no cost to the consumer under most health plans, including the marketplace. The resources on these are provided in the PowerPoint and in our publication. Also in this section is a worksheet. This is something you might actually pull out for the consumer that they might want to keep with their card, their insurance card, or their purse, or another place where they can use it as a quick reference. There's something similar in the back of the roadmap, but here we give a place where somebody can actually write down what their deductible and their copay is so that they have a quick reference. For many, it's on their insurance card, but not always. And here is where we actually provide a consumer a place to walk through their finances and see on paper what they can afford. So first is to figure out what is coming in. Step 2 is what's going out. And then third is to shop for plans. This is a picture of our tool. I just wanted to show you what this looks like. So for some people, this is an easy thing to complete. And for others, it will be the first time that they've really looked at all of their income in one place. So a person can think about it in weekly terms, but also monthly. For a lot of consumers, it's going to be important to think about it monthly because that's how they're paying their premium. And then the next tool is about spending costs. So personally, I know that this is a page I should probably use more regularly myself, and many of us could probably benefit from it. But understanding our actual costs, our real life costs, can help us understand what we have left for our actual real life out-of-pocket costs when it comes to health insurance. So this again will show you weekly and monthly totals. These are tools you can actually give to the consumer. They may ask you to help them complete it, or they can take it home and do on their own. And finally, it's time to look over the consumer's current plan and evaluate if it's right. And once open enrollment begins, to shop for plans. And we always encourage people to apply for financial assistance just to be sure if they are eligible. On this slide, I've listed this as CFPB, the Consumer Financial Protection Bureau, the resource Your Money, Your Goals on the screen. It's a great link for anyone who's looking for more help on finances. And then finally, the last page in Manage Your Healthcare Costs discusses how to pay a premium. Many consumers will choose to do so online, but there are other options which may be harder to find information about. So here we offer some resources on prepaid cards and other options. So next we want to bring our community partners together on the webinar, not just for information about C2C and what we have available, but to discuss how you can get involved in health literacy, how you can use coverage to care resources, and how you can implement it in your own organization. So we have a few tools and a few of our own ideas that we'll go over, and then we'll hear from your peers about how they're using coverage to care. So to frame our mindset, let's recap how we use coverage to care resources. First, we want to start a conversation with a consumer. So you can use the roadmap to help a person decide if they need help with step 1, preventative services, and why they should put their health first, or if they should dig right into step 4 and find a provider. You may only be able to use pieces of the roadmap at once, or you may spread the steps out over several interactions or several events. Refer to the roadmap and provide a copy to consumers so they can reference it. It has a lot of information and you can help them walk through it. And of course, personalize it. We just mentioned one way to personalize, by covering the most needed steps, but you know your community. How else can you help the message best resonate? This could be the way the information is provided, or by slightly tweaking the language. Perhaps adding local resources or your own contact information would be useful. You know your community, so adapt the resources to fit them. There are lots of ways to get involved in coverage to care. This will vary from partner to partner, but we'll go over a few ways today. We have a few resources to help, not just the roadmap, but a number of other materials, including a couple created with you in mind, the Partner Toolkit and Community Presentation. These are designed to make your job slightly easier. We'll talk through those in a minute, as well as some ideas for planning an event. So one of the new resources that we developed last year that we think is most useful for you is the Partnership Toolkit. The toolkit is web-based and is available on our website. The idea behind creating this was to make it a little bit easier for you to use C2C. So anybody can use it. All partnerships are informal, and your participation will vary greatly. Some community groups will use C2C as a minor part of education outreach, and others have a very heavy health literacy focus. We hope this toolkit will be useful for all groups. It was designed to make your job a little easier, provide pre-made materials and language, but it's up to you what you want to use and how much to incorporate C2C into your work. The toolkit starts with information about C2C to offer a little background for your own knowledge, and then we go into ways you can collaborate. It lists all our available resources in our multiple languages and gives ideas on how you can help spread the word. But finally, it's your time to add to momentum. This is where we have sample materials in English and Spanish that you can borrow and make your own. This includes a blog post, a blurb for a newsletter or email listserv, and social media. The social media posts include graphics along with text. On the screen, you'll see a couple examples of these graphics. Each is offered in both English and Spanish, so we can reach a wider network of consumers and partners. Remember, C2C resources are available at no cost to your organization, whether you download them from our website or order print copies to ship to you. We try to make resources available online and for order from the CMS product warehouse. We also have resources available in the additional languages, as we said earlier. The 5 ways in the roadmap and many of the consumer tools and 8 steps are available in English, Spanish, Arabic, Chinese, Haitian Creole, Korean, Russian, and Vietnamese. And for those working with the Native American or Alaskan Native population, again, we do have the tribal version of the roadmap to provide additional information for those populations. So the toolkit gives ideas on how you can get involved. But to help, we have another resource designed with you in mind, the community presentation. So this is a PowerPoint that is already prepared. It has slides that are already done with a script that is already written, and the slides and the script have been cleared as CMS language. We hope community partners can use this to present on their own webinars, their own expos, or other events where C2C could help address health insurance literacy questions. There is a packet of 3 materials, so one is the actual PowerPoint, and then there's a short guide for the person giving the presentation with a few tips, and then finally a handout of all the links and resources that are listed in the PowerPoint. So consider using the C2C community presentation slides, but think of other types of events where you could bring C2C into the plan. Work with local hospitals, clinics, and health centers to add C2C to their roster of community education classes and include C2C as part of the community health fair. Consider hosting an awards breakfast to recognize patients who have done an exceptional job managing health coverage. Or collaborate with community centers to incorporate a C2C presentation into current activities or as a special event. Work with the person who coordinates education classes or group meetings at a local clinic, an adult education institute, civic club, or maybe fitness center. Engage your local church or place of worship to share materials and maybe host an educational session. Host an educational web conference featuring C2C resources and products. Develop a session for a meeting or conference using the presentation. Maybe host a workshop to help people understand how to make the most of their health coverage and walk through the 5 ways and show the video. Hold a Meet Your Provider open house. This is one we've heard of where people will use C2C materials to talk with patients, but also invite providers who are taking new patients so they can actually meet each other. So again, if you'd like printed materials mailed to you at no cost for your organization, you can go to the CMS product ordering website. And that's a screenshot is pictured on your screen with the product ordering.cms.hhs.gov. And that's in yellow and blue on the screen. It's the URL. Again, it's product ordering.cms.hhs.gov. It does ask for you to create an account, but anyone can create an account, and it is free. It just takes a minute. You have to wait for an email confirmation, and then you can log in. And after that, it's pretty similar to other online ordering. You add materials to your shopping cart. You tell it where you want it to be sent. There's just no payment involved. And we also want to announce for anybody who's not on the Coverage to Care listserv to please sign up. Previously, we used our Office CMS OMH listserv, but we are trying to build our C2C listserv too. So please sign up and let us know how to reach you so you can hear all the latest from us. And so now I'll turn it back to Monique, who's going to introduce our guest speakers.
Thank you, Ashley. I'd like to introduce Rebecca Bradley. She comes from the Baltimore City Health Department. Rebecca?
Okay. Good afternoon, everyone. So the SHIP program helps Medicare beneficiaries to understand what their options are and how to choose plans that best meet their needs. In Baltimore City, we've found that many individuals were either uninsured prior to having Medicare or they had medical assistance. And they find that navigating health insurance is a new concept. And so we use the Coverage to Care materials and they find them helpful to the beneficiaries and to caregivers who are assisting the beneficiaries in making decisions about the health benefits. And there are 3 areas that we find that it's been most helpful. The first is understanding your health care, that section. So one thing is that we're telling people what their options are, but they don't understand the definitions. And I know on a few slides back, it talked about the different terminology. So people don't always know what the terms are. So when we can give them the roadmap to better care and a healthier you, we can show them these are the different definitions that you're going to be using, that you're going to see, and for them to read and understand what they are. The other thing is getting information that's found on their card. So most of our interactions are actually by telephone. So we have to help people navigate and recognize where the information is on their health cards. And the last thing with understanding healthcare is actually what to consider when comparing plans. Our office doesn't make recommendations, so we try to give people enough information to figure out what's important to them and make a decision about a health plan. The second area is understanding different types of providers and how the cost of service can vary depending on where they go, particularly when there is a need for a referral or authorization, or they have to be within a network to see a particular provider. And lastly, it's choosing a doctor that's right for them. And so this is so important, I think, in our city, and not just with the SHIP program. So prior to me working with the SHIP program, I worked with a number of community-based health organizations. And what we found is that people do not go to care because they don't like the doctor. They don't like the wait. They think that it's too far, and never think that they can choose a different doctor. So the information and understanding how they can choose a doctor and what information they need to do to figure out the doctor's a good match for them is very important to keep people engaged in healthcare. Thank you.
So just to refresh, thank you, Rebecca, so much. For those who may or may not know this, SHIP counselors, most states use that term, but it's the state health insurance program, assistance program, and namely those were the counselors who were created through health departments or offices on aging to help a Medicare beneficiary, in particular when choosing a Part D plan. But as you can tell from Rebecca talks about, that they really will go a lot past that, but do focus on a Medicare beneficiary. So thank you, Rebecca, for those great examples and showing us how you've used coverage to care with Medicare beneficiaries and their caregivers.
Thank you, Rebecca and Ashley. I would like to now turn it over to Monica Gonzalez. She is the Navigator Project Director for the Epilepsy Foundation of Florida. Monica?
Right now. Nothing. When are you available? You can ask for a list of things.
Move over to Monique Scott while Monica returns to us. Monique Scott is the Health Insurance Specialist at the CMS Regional Office. Monique Scott.
Thank you so much, and thank you everyone for taking time out of your busy schedules to join us today for this webinar, and thank you to our CMS staff and the Office of Minority Health. Again, my name is Monique Scott. I'm a Health Insurance Specialist in the Philadelphia Regional Office of the Centers for Medicare and Medicaid Services, also known as Region 3, located in Philadelphia. The states that we cover are Pennsylvania, Maryland, Delaware, Virginia, West Virginia, and the District of Columbia. From the beginning, we have found the Coverage to Care initiative to be well received throughout all the various partner groups and audiences that we serve. I sit on a regional external affairs team where we do a lot of beneficiary and consumer outreach across a variety of CMS programs. We work with the SHIPs as well, and we introduced it to the SHIPs pretty much around the same time we introduced it to the marketplace navigators and Assister when the health insurance marketplace was coming online, because we saw the materials were broad and generic and could be used from that audience as well. So besides, hosting our own regional conference calls and webinars, we really promoted the initiative and people to get involved throughout all of our speaking engagements, taking it out to materials at any partner events, tabling events that we're doing, and really just making sure that awareness was being built. Outside of the Medicare-specific consumers that were already on the program and the marketplace consumers as well, one of the other areas that we found success with using it is with employers and retiree groups. Oftentimes we do pre-retirement workshops, and a lot of times working with retiree groups or unions or even human resources staff at local employers. They found it very beneficial as well for their own employees and their own members trying to understand their own benefits that they had. They also are caregivers or family members or friends of other people in the community, regardless of what those people may have as their insurance status. So everyone found it very helpful. So definitely encourage them to let their employees know and share it with their family members and friends as well as they kind of go through the insurance process to help with some of the basic insurance terminology that's there. The roadmap, the 8.5 by 11 is very helpful, as well as the booklet. We also serve a variety of different partners who have diverse populations. We have on our team also worked with Asian American Pacific Islander populations, as well as Latino populations and populations that we're very happy to see that the booklet was available, as well as many of the other Coverage to Care materials in a variety of different languages. So that has also been well received, and I know many of our partners have reported as well. That's really helped them make bridges into some of other communities and partners that serve other communities that speak languages other than English and Spanish, that it's been a helpful resource for them. So definitely, besides Medicare and the marketplace, we would encourage you to consider if you have connections or can make connections with local employers as well, that's something that they may find useful as well. Also wanted to encourage you, if you haven't already connected with your CMS regional office. There are 10 regions around the region. The Philadelphia regional office is just one of them. Your regional office is also a great resource as far as helping to facilitate connections with other local communities and partner groups within your state or within other states as well who may do the same type of work. So thank you again for all that you do. We appreciate your continued partnership and support. And with that, I will turn it back over to our moderator. Thank you.
Thank you very much, Monique. I'm also going to call on Monica Gonzalez and Ashley Petticourt to give an overview of what the Epilepsy Foundation of Florida is doing to support patients and caregivers in their community.
Monica, are you there? Okay, looks like we might have lost her, which is unfortunate because they're doing a lot of really great work. She's with the Epilepsy Foundation of Florida. Oh, is that you?
I am here. Can you hear me?
Great, that sounds good. Please go ahead.
Okay, good afternoon, everybody, and I am so sorry about the technical situations we've been having. Epilepsy Foundation has been a navigator organization since the first open enrollment, and early on we noticed there was a great need to educate the consumers that we did enroll on the use and the benefits of their health care coverage. So we really wanted to make coverage to care an integral part of our post-enrollment planning throughout the years. What we started doing was we decided that we wanted to do coverage to care as a workshop, and so we designed a lesson plan around it. The lesson plan had its objectives, had topics that were covered that were in line with the steps from the C2C roadmap. We developed PowerPoint presentations that were geared towards the populations that we had identified that we wanted to serve. Many of those populations, since we do have a lot of diversity in South Florida and in Florida, the populations were historically underserved and underprivileged populations, and we developed our PowerPoints and our materials in Spanish and Haitian Creole, and the literacy level was brought down to be able to be something that those populations that we intended to serve would easily understand. We also created our own handouts, our assessment tools, and retention tools. So we even actually give those people at our presentations and the attendees a small test so that we can actually gauge if the people learned enough to be able to use the information in their day-to-day activities. And so one of the things that we actually did is we identified a population we wanted to serve. We identified a region where we had a high density of the population we wanted to serve. Then we identified community partners that were already serving the population, and that is key to the success, because those partnerships with those stakeholders, this community, are the ones that are going to allow you to enter their facilities and to present to that audience. They're already serving that audience. So we partner with organizations like the East Coast Migrant Head Start Project. We'll partner with Glades Family Education Programs. We partnered with ESOL programs at local colleges. We partner with a lot of faith-based organizations. And so we present in 3 languages almost consistently. And another best practice is that we actually hire navigators to facilitate the presentations from within the communities that we're presenting to. So these navigators are conducting the workshops in the languages that are understood by the population, and they're from that neighborhood. They're from that population. So it makes it more interactive. They understand the population, and the attendees ask questions and trust the facilitator. It has been a very successful program. We've taken it from the pilot, and actually we're doing it statewide at this moment. And so we find that the materials have been very, very helpful. We have modified some of the CMS materials, and like I said, we have actually modified it so it's at a literacy level that's understood by those populations that we're serving. But those partnerships with community agencies and organizations, that is key.
Thank you, Monica, and all of our guest speakers. This question goes out to Rebecca. How did you help patients start thinking about getting that first appointment and selecting a provider for those patients who were new to insurance? Are there any tips that you used in your community?
So one thing is on the CMS website, you can look by zip code for providers. So when people share that they don't have a provider or they're not going to their provider anymore, they want to change a provider, we help them see what the options are. Well, what's in their community, if that's what's good for them. Other times it may be, in Baltimore there are several hospitals. So if there's a hospital that they want to go to, then we'll figure out what doctors are based in that particular facility. So we'll give them a list of providers for them to look at. I'm sorry.
No, thank you. I was just going to clarify that you're thinking about Medicare in the Medicare.gov website.
Yes.
And providers.
Thank you both. This question is for Monique Scott. You mentioned outreach to employers, which is an interesting approach, especially that small businesses that employ so many people in communities. How did you approach those employers to be open to providing this type of education to their employees?
Thank you for the question. That's a great question. We pretty much approach this as a helpful resource. As with most things, when you make those types of overtures or you try to reach out to folks, some people are very receptive, some people not so receptive, but once they realize you weren't trying to sell them anything, so to speak, and it was just helpful information, most people, whether they wanted a speaker to come out or not, were very interested if we, would have material sent to them. It's something that they could have, particularly if they didn't necessarily need large quantities, or a website that they could look to, or direct their human resources to, or that they could look to themselves. Again, I think because coverage to care is broad and generic enough that it wasn't necessarily just Medicare specific or marketplace specific, but it just talks about health insurance in general to get people familiar. So basically we approach it as, here's something that may be helpful to you, to your employees, to the people in the community that you serve.
Thank you, Monique. This question goes to Rebecca and Monica. We have several folks on the line who have an engaged community in their health centers. But do you have any tips on how do you reach those people who are not yet connected to care and not in the health center environment?
I'm sorry, this is Rebecca. That was a difficult question. So I think that's one of the challenges that we have, is that people who are not engaged. But sometimes what we've found, and actually I have a particular group that I meet with every month, which it's not a health setting, it's a senior center, and we go in to share information with them about Medicare and health services and services through our agency. And so once they do have questions, or other people, like sometimes they'll tell you that a neighbor is referred by one of the participants at that senior center because we're going out doing the presentations there.
This is Monica. We've actually built a platform on our Coverage to Care workshops at locations that are not specifically healthcare facilities. We've actually partnered and engaged with community agencies that are providing other types of services to the community that we want to serve. And so the people that are attending these facilities, these agencies, these neighborhood community centers are going in on a regular basis for other types of services, and perhaps they are going in for another type of educational component. And we will, engage that community partner to become a part of their educational, components as well. So what we've really done is we really partnered well with agencies that cater to these communities, and it doesn't necessarily have to be at a healthcare facility or at a clinic. We do so much with local colleges. We do so much with migrant and Head Start programs, farm worker councils. We do a lot with the faith-based organizations, especially with the faith-based, because many times the pastors will allow you to present to the congregation before services or after services. It's all about making the right thing.
Important. That's a great question. And older Americans see that it's so important that we really do have to get people into the care to help diagnose.
Email us. If you have trouble creating an account, free to email us. So our website is...
Depends on your you share new materials with others that you work with. Or maybe it's something more in-depth. Maybe you're a navigator, and every time you enroll somebody or help somebody pick a plan, you walk through the roadmap, or you hand them the 5 ways after you've helped them. Some organizations like Monica's will even do even more elaborate coverage to care and health literacy. She told us previously about how they'll follow up with a person and make sure that they made an appointment and went to a primary care provider. So it's going to vary. It can depend on what you already are planning and what type of organization you are. But what we want to stress that's really important is that use what you're already doing. You're already planning an event, or you're already planning some sort of interaction with a consumer or partnering with another community organization. Use that as a way to build coverage to care into the work. So maybe you only do step 1 at one event, and then maybe a few months later you might do something on step 4 and making the appointment. So focus on it in pieces, but do as much as you can for your own organization, and do what makes sense for your community.
Thank you, Ashley. We did want to highlight that next month is Minority Health Month. It's a great time to have some of the 5 things to know and C2C materials out and available in your organizations. If you do want to have some of those materials in time for April, we would encourage you to either go to the product ordering website or to email us. We'd be happy to ship those to you at no cost. And so we also would encourage you to spread the word on social media if you're trying to access communities out there. With that said, I think we've answered all questions, but again, if you have anything else that you'd like to engage with us on, if you could please email us or go to our website. We also wanted to encourage you to let us know what you're doing. We want to hear from you. The CMS Office of Minority Health is your partner and your resource, and we'd like to have a continued dialogue with you. Let us know what's working for you, what materials you need, what additional languages you're hoping to see materials in. We thank you for your time today. We really appreciate all that you're doing in your communities. After we close this webinar, there will be a brief feedback form. Again, we're here to listen to what your needs are. If you would please take just a few minutes to fill that out, we would greatly appreciate it. Thank you so much for your time, and have a wonderful day.